take the tube and we put it on the back of the neck, and we go in and grab the handlebars. Again, in our rehabilitative process, we always focus on putting the tongue on the frenulum to make sure that when we retrain ideal form and function, that we keep consideration of the relationship of the TMJ muscles to the order of the neck muscles and the movement of the head and neck. So we're going to be again in the upright posture. We're going to take the handlebars and we're going to stretch them out. For those who are comfortable enough, we'll go and extend the elbows completely. And if this is difficult, as I said, take one of the bungee cords and hook it and only use one cord. We have initially developed it so that the arms would be flexed, and some people will be able to do that, but others will not. They're not strong enough. And so then we have made them a little bit more pliant, if you will, so that the individuals can lock the elbows. Once they get them out there and lock them, it's relatively easy to hold out there, and they're quite stable, and most human beings can do this, as I said, with one or two cords. More strong and athletic people will add cords to it. Once we're in that position, the start of the motion is from here. We're not going to be moving the hands. What we're going to be doing is moving the head in a very, very, very linear plane. What that means is you're going to keep your teeth or your bite line level to the floor as you move the head, translate it on a single plane of motion like this here. The pelvis and the lumbar spine will not do anything. It has to be stable, and it has to have the normal arc or forward arch in the lower back. You're really going to perform this motion from the rib cage up. So at an angular perspective from where we are right now, we'll lock the elbows, keep the head into the upright posture. Notice that I'm not slumping. So what I'm going to do from here is move the head and translate it backward or posteriorly. So this brings the body back up onto its center. It makes it work to do so, and it causes the neck curve to be forced back into its arc. And when I showed you the arc with the flexible pipe, as I said, I'll do it in a large arc. If one has deviated to the side like this, the force of the tube in the middle will make the arc come to neutral position. If one is deviated to this side, the arc will still make the person go to the neutral position. If a person is backward, it has to unwind it to the neutral position. If they have very complicated curves, it still is forced to go back into the central position. So I move the head back into a central linear plane, and we're going to hold 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. After we've done that about 5 times, then we're going to go and hold it back, and then we're going to bend and bend and bend and bend and bend, again with the tongue on the frenulum. So now we're causing the force of ranges of motion to continue to force that curve to come back into an ideal position. Then we're going to go into turning. While we're keeping that backward motion and tension on the bungee cords. Then we're going to go into forward bending, where the muscles that actually pull the curves into the spine pull it in from the front, not from the back. Although this works all of the muscles, it works the front ones much, much more assertively, and that's what puts the curve back in the neck, it also unlocks the skull, which 97% of the people on the planet that we've x-rayed have locked extension or backward position, disposition of the head in relationship to the neck. The reason why is that they have locked the skull backward, the visual axis is too high to the horizon, and they move forward like this to have appropriate relationship to the three-dimensional world with the skull being fixed backwards. So this motion here trains that back out, puts the curve back in, as well as unlocks the skull. So we want to center it on the back of the neck, so it cradles the neck. To emphasize and to rehabilitate the upper part of the neck where the skull is locked into extensions, so many people have problems with, we're going to add one more exercise and move the cords up at an angle like this and hook that pad right up underneath the skull. And we're going to restore the forward flexion motion of the skull that so many people desperately need. And so then the last exercise we're going to do is to put it up on the center of the skull, which requires a little balance and coordination. And this is really good. If we're not good at it, it's good that we continue to try to be good at it because it's so powerful for neuromuscular re-education and integrity. Now we're going to take the head and move it back into that backward plane again keeping the teeth level to the floor. And on this one here, you'll see that you're going to feel all those muscles all the way down to your tailbone engaged that are responsible for keeping you in the upright posture. When you do these exercises for even less than 2 minutes, 1.5 minutes, I'll run through the whole protocol quickly, and you will feel immediately that your body wants to stay very, very upright, and it is not easy for you to slump. And as soon as you start to slump, you're going to feel tension on the tissue. That means that the body is not welcoming that posture. The body is welcoming the ideal posture. So this will continue to train in remarkably ideal and upright posture that so many of us are afflicted with. And in old age, we simply, as I said before, have to make a decision. Are you going to continue to go south, and I don't mean Florida, or are you going to stay upright in line with gravity for as long as possible? That's what these exercise protocols are for, and they're powerful to do so. And again, I think our systems are the most advanced and effective in existence. So I'll do the whole protocol now. We'll put the tension on. How long does that take? Not very long. And right now, as I sit here having to do those exercises, including the demonstration, it is difficult for me to get out of gravity. It is easy, it is natural, it is effortless for me to stay totally upright and centered. It is more effort to lean forward and get out of gravity. It is therefore very, very, very trained in ideal upright posture that so many in our culture are being compromised from